Hello to all the dentists out there. So this is the dental exam practice questions, which is a question bank, and for the part one, and it's relevant for ORE, ADC, the Hong Kong Dental, MJDF, MFDS, and also revision for the final year students. Now, I recommend you to grab a pen and paper and let's solve the questions together. At the end of this question bank, I've also given an assessment form so you can assess your preparation. Now, question number one. Which of the following has proven to be the most important in community prevention program? A. Dental awareness. B. Institution of oral hygiene measures. Or C. Water fluoridation. Now here guys, you can pause the video, answer the question, and then see the answer, which is just coming up next. The answer is C. Water fluoridation. Question 2. Which effect has placing a sealant over pits and fissures on the progression of caries? A. Decrease new caries. B. Increase new caries. C. Progression of existing caries. Or D. No effect on existing caries. Now the answer is A. Decrease new caries. Question 3. In advanced periodontitis with marked mobility, teeth may be splinted. A. To improve comfort of patient. Or B. Splinting helps in transmitting force to adjacent teeth to reduce load on the involved tooth. The answer is B. Splinting helps in transmitting. Question 4. Swallowing will aid in diagnosis of brachial cyst, thyroglossal cyst, ranula, or retention cyst. The answer is thyroglossal duct cyst. Question 5. Which of the following will increase sharpness? A. Large focal point. B. Smaller focal point. C. Increase object to distance film. Or D. Decrease patient source distance. The answer is smaller focal point. Question 6. In severe periodontitis, the probe will eventually be A. Prevented to go deeper by calculus, beyond connective tissue in the junction epithelium, at the end of the junction epithelium, or D. Touching the middle of the junction epithelium. The answer is at the end of the junction epithelium. Question 7. A 55-year-old male has been treated with radiation for carcinoma of tongue. The patient complains of pain associated with poor dentition. The dental management would be A. Immediate extraction of the poor teeth under LA with antibiotic coverage. B. Segment dental clearance and closure to eliminate problems. C. No dental treatment due to neoplasms. D. Clearance of the poor dentition followed by hyperbaric oxygen treatment plus primary closure of wounds and antibiotics. And E. No extraction as radiant necrosis is an imp seculi. The answer is no extraction. Question 8. Which of the following is not true regarding anticoagulative therapy? A. INR of 3 is enough to start any extraction. B. Affects extrinsic system and increases prothrombin time. C. Heparin can be given subcutaneously. Or D. It takes at least 12 hours of vitamin K to reverse the effects. The answer is D. Question 9. In a radiograph, the roots of the upper teeth are too short because inadequate horizontal angulation, too high vertical angulation, or C. Too small vertical angulation. The answer is too high vertical angulation. Question 10. Characteristics of squamous cell carcinoma of the tongue. A. More in white-skinned people. B. More in alcohol drinking or smoker males. Or C. Associated with Plummer-Wilson syndrome. The answer is more in alcohol drinking and smoker males. Question 11. Characteristics of squamous cell carcinoma of the lips. A. It reacts fast simply to radiotherapy. B. Metastasizes mainly by blood. Or C. Relatively rare in Australia. The answer is metastasizes mainly by blood. Question 12. What type of dentine is not formed due to pulp pathology? A. Reparative dentine, secondary dentine, primary dentine, reaction dentine, or tertiary dentine. The answer is primary and secondary dentine. Question 13. Normal prothrombin time and elevated partial thromboplastin time is seen in A. Factor A deficiency, hemophilia, and I'm sorry guys here, I think the hemophilia, I wrote it in the Danish way by mistake, so apologies on that. B. Leukemia, C. Walbridin factor, and D. Thrombocytopenia. The answer is factor A deficiency, hemophilia. Question 14. What does the term caries prevalence mean? A. Total number of caries areas affected and any present caries, or B. The individual risk of patient to acquire caries. The answer is total number of caries areas affected and any present caries. Question 15. Which of the following are features of herpetic gingival stomatitis? A. Irritability, fever, occurrence in teenagers, or D. Occurs only in buccal mucosa and tongue. The answer is fever. Question 14. Which of the following is a feature of Streptococcus mutans? A. It does not require a special environment to grow. B. It can easily be transported to one part of the oral cavity to another. Or C. It has the ability to restructure carbohydrates. The answer is it can be transported to one part of the oral cavity to another. Question 15. A patient in your dental chair suddenly becomes agitated with shallow breathing, full pulse and blood pressure of 150 to 80. You would A. Give oxygen, B. Give glucose, give insulin, or place patient in supine position. The answer is give oxygen. Question 16. EDTA has useful roles in certain situations in clinical dentistry. When would you use EDTA? A. As root and filling material, as pulp capping agent, as root canal irrigant, as a mouthwash, or E. As a dentine bonding agent. The answer is as a root canal irrigant. Question 17. A patient presents with a history of clicking from their temporomandibular joint. This click occurs midway through the opening cycle and is consistent. There is some pre-auricular pain and the lateral pterygoid muscle on the affected side is tender to resistive movement test. There is no trismus and the click is not present when the patient opens from an incisor edge-to-edge relationship instead of her normal class 1 occlusion. The patient would like treatment. The most appropriate occlusal splint for this patient would be A. Stabilization splint, B. Localized occlusal interference splint, C. Bite razor, soft bite guard, or E. Anterior repositioning splint. The answer is stabilization splint. Question 18. A patient presents with a history of a pulse crown having fallen off. The pulse crown was originally placed 15 years ago and has been successful up until 4 months ago, since when it came out, and has been re-cemented 4 times. At re-cementment, there was no evidence of any caries. The patient has been a regular attender and not needed any restorative treatment for the last 8 years. Which of the following is the most likely cause for the failure of this crown? A. The post was too narrow, B. The post was too short, C. The root canal treatment was failing, or D. A vertical root fracture was present, or E. There was excessive occlusal load on the tooth. The answer is a vertical root fracture was present. Question 19. An adult patient attends your practice complaining of pain and swelling associated with the previously restored upper first premolar tooth. The pain has been present for a number of days and is no longer responding to analgesics. His dentition is otherwise well maintained and his periodontal health is good. What is the main appropriate approach to treatment? A. Antibiotics and analgesics. B. Extract the tooth. C. Carry out the pulpotomy and temporary dressing. And D. Drainage. The answer is drainage. Question 20. A patient complains of lower incisor which has been mobile for several months. The radiograph indicates a normal level of bony support, although the periodontal space was widened. The apical bone appears normal. The tooth is tender to pressure. Which of the following tests or examination would be most likely to provide a diagnosis? A. Masticating muscle palpation, electric pulp test, occlusal examination, ethyl chloride, or gutta percha application. The answer is oral examination. Alright guys, now time for assessment. So if you got 16 or above correct, that would mean that your basics are good. So you just need 2 to 4 months of preparation. But if below 16 you got wrong, that means you need more preparation, approximately 6 months. So that's how you assess yourselves with these questions. Rest, I would keep on uploading the question banks occasionally, and I assure you that they would be more than enough for you to have a good preparation. And after doing these questions, when you would read the book or start preparation, it would be much easier for you. So I would upload them shortly. Thank you very much. I hope this helped, and stay tuned for more.